welcome to my vlog. For today's video, we'll talk about the synovial joint movements. Gliding movements. One flat bone surface glides or slips over another similar surface. Example, intercarpal joints, intertarsal joints, between articular process of vertebrae. We find then for gliding movements, and if you move your wrist side to side as if to say hello, you know these bones can just kind of slip across each other, and that allows for a little bit of degree of movement between those bones. Angular movements. Increase or decrease angle between two bones. Movement along sagittal plane. Angular movements include flexion, decreases the angle of the joint. Extension increases the angle of the joint. Hyperextension, movement beyond the anatomical position. An example of this, think about the neck in anatomical position. There's an angle here between your neck and the dress of the chest. Now, if you decrease this angle by looking downward, this technically considered flexion because we'll be decreasing the angle at a joint, and if you go back to normal anatomical position, that would be extension because now you're increasing the angle that joint. If you go even beyond the normal anatomical position, that would be hyperextension. So you actually can hyperextend the head, the neck by looking up. Another angular movement. Abduction. Movement along frontal plane away from the midline. Adduction. Movement along frontal plane toward the midline. Circumduction involves flexion, abduction, extension, and adduction of limb. Limb describe cone in space. So if you think about abduction, that would be like drawing a limb of a body part away from the midline. So if you can raise your arms outward, that's abduction. Or if you bring your arms back towards the midline, that's going to be a deduction. And circumduction would be like drawing a circle with a limb, and it's a mixture of lots of different types of movements. Same goes for the leg and thigh and the leg or lower appendage. You can actually do abduction of the lower pitch and adduction and circumduction as well. Rotation. Turning of bone around its own long axis toward midline or away from it. Medial. Rotation toward midline. Lateral. Rotation away from the midline. Example, rotation between C1 and C2 vertebrae. Rotation of humerus and femur. Supination and pronation. Rotation of the radius and ulna. Supination. Palms face anteriorly. Radius and ulna are parallel. Pronation. Palms face posteriorly. Radius rotates over ulna. Dorsiflexion and plantar flexion of foot. Dorsiflexion, bending foot toward shin. Plantar flexion, pointing toes. Supination and pronation. Rotation of the radius and ulna. Supination. Palms face anteriorly. Radius and ulna are parallel. Pronation. Palms face posteriorly. Radius rotates over ulna. Dorsiflexion and plantar flexion of foot. Dorsiflexion, bending foot toward shin. Plantar flexion, pointing toes. So, supination is pointing your forearm where your palms actually facing anteriorly, and then pronation is the opposite. So, if you try that on your own, buying right now, if you actually stick your arms out and then basically move your form in a way that you allows your palms to face anteriorly, that's gonna be supination. So if you can see your palms, that's supine, and then if you face the palms posterior by doing the opposite rotation, that's what we call pronation. And we have specific muscles for this. Now it's interesting those if you look at pronation, you can see that the radius crosses the ulna here, and if you look at supination, the radius and all-nighter side by side, so it's really cool. Then, as the radius can actually rotate around the ulna, and that's why it's considered a rotational movement. Another special movement: inversion and eversion of foot. Inversion, sole of foot faces medially. Eversion, sole of foot faces laterally. Protraction and retraction, movement in lateral plane. Protraction, mandible juts out. Retraction, mandible is all toward neck. Now, dorsiflexion is pointing your toes upward, and then plantar flexion is pointing your toes downward. Another special movement: elevation and depression of mandible. Elevation, lifting body parts superiorly. Example, shrugging shoulders. Depression, lowering body part. Example, opening jaw. Opposition, movement of thumb. Example, touching thumb to tips of other fingers, same hand, or any grasping movement. So remember, inversion is pointing to sole of your foot inward, eversion is pointing the sole of your foot outward. And then, protraction of the mandible is kind of shutting it outward here, and then retraction of the mandible is drawing it backward. You can do this with a scapula as well. Like if you draw your scapula anteriorly, that's gonna be protraction, or if you draw your scapula backward as if to pull your shoulders back, that would be retraction of the scapula. So remember, elevation, the mandible is closing it, and the depression of the mandible is sort of opening your mouth by lowering the jaw or mandible. Now, opposition is where you can have your thumb and other digits connect. So your thumb might connect with your index finger, your middle finger, your ring finger, or your pinky finger. And that would be considered opposition. Now we actually have muscles for opposition, and we even have some opposition ability of our toes, but it's much far more limited than opposition in our fingers.